Medicaid, a cornerstone of America's social safety net, is a massive government program. It's one of the largest sources of funding for medical and health-related services for people with limited income and resources. This vital program is responsible for providing health insurance to over 80 million Americans, nearly 1 in 4 people across the nation. That's a significant portion of the population relying on Medicaid for their healthcare needs. It serves low-income children, ensuring they have access to essential medical services during their formative years. It also supports pregnant women, providing crucial prenatal care and ensuring healthy pregnancies and deliveries. Medicaid is a lifeline for seniors in nursing homes, covering the costs of long-term care and allowing them to live with dignity in their later years. And it provides essential healthcare services to people with disabilities, helping them lead more independent and fulfilling lives. Despite its broad reach and the critical services it provides, Medicaid is a constant target in political battles, often caught in the crossfire of ideological debates. These challenges come especially from Republicans who frequently view the program as fiscally unsustainable, arguing that it fosters dependency and places an undue burden on taxpayers. Consequently, efforts to cap federal funding for the program or transform Medicaid into block grants, giving states more control over how the money is spent, have repeatedly surfaced in legislative discussions. These proposals are often framed as necessary steps toward achieving fiscal responsibility and reducing the national debt. Yet any attempt to significantly cut Medicaid is politically risky. Its beneficiaries are everywhere, representing a broad spectrum of American society. This includes elderly parents who rely on Medicaid to cover the costs of long-term care. It also encompasses children with complex medical needs who require specialized care and ongoing treatment. And it supports low-wage workers who often lack access to affordable health insurance through their employers. Beyond individual beneficiaries, the program is also a financial lifeline for hospitals and nursing homes, particularly those that serve a large number of low-income patients. This is especially true in rural areas where Medicaid often plays a critical role in keeping healthcare facilities afloat. Consequently, cutting Medicaid funding threatens jobs within the healthcare sector and limits access to care for vulnerable populations. This creates a broad coalition of defenders, including patient advocacy groups, healthcare providers, and community organizations, who are committed to protecting the program. As of July 2025, Republicans are again proposing major changes to Medicaid, signaling a renewed effort to reshape the program. This sets the stage for fierce policy battles ahead, as Democrats and other advocates vow to fight back against any measures that would undermine the program. Therefore, understanding this ongoing conflict is key to grasping the future of America's health safety net and the well-being of millions of Americans who rely on Medicaid for their healthcare needs. The story of Medicaid is a journey through the evolution of American healthcare. It's a tale of good intentions, unforeseen consequences, and enduring political battles. Medicaid began in 1965, born out of a desire to provide essential medical care to those who needed it most. It was conceived as a federal-state partnership, a collaborative effort to ensure the nation's poorest citizens, offering a lifeline to families struggling to access basic healthcare services. The initial vision was one of shared responsibility and a commitment to social welfare. States were entrusted to run the program within broad federal guidelines, allowing for some flexibility to tailor the program to their specific needs and demographics. This included the crucial task of deciding eligibility criteria and determining the scope of benefits offered to recipients. Each state had the power to shape its Medicaid program, leading to variations across the country. For many years, Medicaid operated as a relatively modest and low-profile program, quietly serving its intended purpose without attracting significant attention. It was a safety net, providing essential care without generating widespread controversy. However, the landscape began to shift dramatically as rising healthcare costs became a major concern in the 1980s and 90s, inevitably drawing increased political scrutiny to programs like Medicaid. The escalating expenses raised questions about efficiency and sustainability. Critics began to argue that the open-ended nature of federal funding created an incentive for unchecked spending, leading to concerns about fiscal responsibility and the long-term viability of the program. As government spending grew, Medicaid increasingly became a symbol of government expansion and perceived inefficiency, fueling debates about the appropriate role of government in healthcare. This led to a gradual shift in the political debate, moving away from the original focus on helping the poor and towards a greater emphasis on limiting federal costs and controlling government spending. The 1990s marked the beginning of the first major attempts to cap Medicaid spending and shift more control and responsibility to individual states, reflecting a growing desire for greater state autonomy. This philosophy of state control and limited federal intervention continues to drive many Republican healthcare proposals to this day, shaping the ongoing debate about the future of Medicaid. The passage of the Affordable Care Act in 2010 brought about a dramatic expansion of Medicaid eligibility, extending coverage to millions of previously uninsured Americans. However, this expansion also deepened existing partisan divides, further polarizing the debate surrounding healthcare policy in the United States. While some states enthusiastically embraced the expansion of Medicaid, recognizing the benefits of increased coverage for their residents, others strongly resisted, citing concerns about the financial burden on their state budgets, ultimately leading to the patchwork system we see today, with significant variations in Medicaid coverage across the country. Medicaid's expansion and the subsequent resistance to it solidified its position as a central battleground in America's ongoing healthcare wars, a symbol of the deep ideological divisions that characterize the debate. The program's fundamental structure and its far-reaching impact on the lives of millions continue to fuel intense political battles, ensuring that Medicaid will remain a key point of contention in American politics for years to come. The first big push to overhaul Medicaid came in 1995, with Republicans proposing block grants to cap federal spending. Opponents warned this would mean deep cuts, especially during economic downturns. Advocacy groups and President Clinton fought back, and the plan was vetoed after a government shutdown. This set the playbook for defending Medicaid. In 2017, Republicans tried again, aiming to phase out the ACA's expansion and cap funding. The Congressional Budget Office projected millions would lose coverage. Republican governors, hospitals, and advocates opposed the cuts, leading to a dramatic Senate defeat. Even with unified government, Medicaid's popularity and integration made cuts politically perilous. The failures of 1995 and 2017 show how deeply Medicaid is embedded in American healthcare. Cutting it remains a high-risk political move. Republicans see Medicaid's growth as a budget crisis, arguing that open-ended federal funding encourages overspending. They propose block grants or per capita caps to force states to spend more efficiently. This fiscal argument is tied to beliefs in limited government and personal responsibility. Many conservatives argue Medicaid discourages work and fosters dependency, fueling pushes for work requirements. Republicans also want states to have more flexibility, believing local officials know their populations best. They argue that federal rules stifle innovation and crowd out private insurance. Limiting Medicaid, they say, would strengthen the private market and encourage employment-based coverage. These ideas form the backbone of the Republican approach to Medicaid reform. In 2025, House Republicans have again made Medicaid reform central to their agenda. Their plan proposes per capita caps or block grants, ending open-ended federal funding. States would get more flexibility, but only if they roll back ACA expansion. Nationwide work requirements for able-bodied adults are also included. While unlikely to pass in a divided government, the proposal sets the stage for future battles. It highlights the sharp contrast between Republican and Democratic visions for healthcare. The debate over Medicaid's future is far from over. Medicaid's quiet popularity is a major obstacle for those seeking cuts. It's the largest payer for long-term care, covering 2/3 of nursing home residents, often middle-class seniors. The program is vital in rural America, supporting hospitals and local economies. Medicaid covers a higher percentage of rural residents and is crucial for emergency care and substance abuse care. It's also the largest insurer of children and a lifeline for people with disabilities. When cuts are proposed, the real-world impact on these groups sparks fierce opposition. The 2017 repeal effort saw emotional public backlash, with stories from those who depended on Medicaid dominating the debate. This disconnect between policy goals and constituent needs makes deep cuts politically toxic. Medicaid's broad reach ensures it remains a difficult target for major reductions. Democrats see Medicaid as a vital safety net to be protected and expanded, not cut. They champion the ACA's expansion, pointing to better health and financial outcomes in expansion states. Their goal is to close the coverage gap in states that haven't expanded Medicaid, possibly through federal fallback options. Democrats oppose block grants, caps, and work requirements, arguing these would erode coverage and harm vulnerable groups. Instead, they want to use Medicaid to address broader health challenges, like mental health, maternal care, and home-based services. For Democrats, investing in Medicaid means healthier communities and lower long-term costs. The debate is framed as a choice between investing in public health or imposing harmful austerity. Medicaid, a cornerstone of the American healthcare system, provides coverage to a vast number of individuals. It's a program designed to ensure access to medical care for those who might otherwise be unable to afford it. Currently, Medicaid covers over 80 million people, a testament to its crucial role in the nation's health safety net. This includes a wide range of demographics from children and pregnant women to seniors and individuals with disabilities. That's nearly a quarter of the U.S. population. This significant reach underscores the program's importance in providing healthcare access across various socioeconomic groups and geographic locations. Medicaid's impact extends far beyond just providing basic healthcare. It plays a vital role in specific areas of healthcare, supporting vulnerable populations at key stages of life. For instance, it finances about 40% of births in the United States. This support is critical for ensuring healthy starts for newborns and providing essential prenatal care for expectant mothers. Furthermore, Medicaid covers 60% of nursing home residents, offering crucial long-term care services to seniors who require assistance with daily living and medical needs. It also supports half of children with complex health needs, ensuring they receive the specialized medical attention and resources necessary for their well-being and development. Medicaid accounts for 16% of all U.S. healthcare spending, reflecting its substantial financial commitment to providing healthcare services across the nation. This translates to over $800 billion spent annually, highlighting the significant investment in ensuring access to healthcare for millions of Americans. For states, Medicaid is both a major expense, requiring careful budget allocation and financial planning, yet it's also their largest source of federal revenue, creating a complex financial relationship between state and federal governments. The Affordable Care Act's expansion of Medicaid led to lower uninsured rates across the country, extending coverage to previously uninsured individuals and families. This expansion also spurred economic benefits in participating states, boosting local economies and creating jobs in the healthcare sector. The federal government pays 90% of expansion costs, providing a substantial financial incentive for states to participate in the program. This high level of federal funding is designed to incentivize states to join and expand healthcare access to their residents. However, the end of the COVID-19 emergency triggered a massive eligibility review process, requiring states to reassess the eligibility of all Medicaid enrollees. This review, while necessary, caused millions to lose coverage, highlighting the challenges of maintaining consistent enrollment in a complex system. Often, these coverage losses occurred due to paperwork issues, bureaucratic hurdles, and difficulties navigating the complex enrollment process. This situation highlighted Medicaid's administrative complexity and the challenges individuals face in accessing and maintaining their healthcare coverage. It also underscored the real-world impact of policy changes and administrative procedures on the lives of millions of Americans who rely on Medicaid for their healthcare needs. Given its vast reach and significant financial implications, the program's scale and stakes make it central to America's ongoing healthcare debate. Every policy decision related to Medicaid has the potential to affect millions of lives, shaping their access to healthcare and overall well-being. These decisions also impact billions in spending, influencing state and federal budgets and shaping the future of healthcare financing in the United States. The Republican push to cap and restructure Medicaid is rooted in deep beliefs about government's role and fiscal discipline. But Medicaid is woven into every community, supporting hospitals, nursing homes, and millions of families. This broad constituency mobilizes fiercely to defend the program. The political risk of cutting Medicaid is immense, as seen in past elections. The debate is a fundamental clash of values. Democrats see a vital safety net. Republicans see an unsustainable entitlement. The outcome will shape federal and state budgets, and the health of millions. As the 2026 elections approach, Medicaid's future is on the ballot. Voters face a choice between two starkly different visions for healthcare. The question of Medicaid's role remains one of America's defining public challenges.